Coronavirus, as Rachel said, spreading around the world and in this country. Just tonight, as Rachel commented on, officials in Oregon reporting a case of coronavirus that is of unknown origin. This is important. This is now the third coronavirus case in the United States of people who have not traveled or knowingly interacted with anyone who had traveled to a high-risk area. Now, officials say the Oregon case is somebody who's a resident of Washington County who experienced symptoms on February the 19th. That was Friday. It was tested today, hours after a laboratory received a new test kit from the Centers for Disease Control and Prevention. That is also an important point that I'm going to talk about today. We learned about the second case of coronavirus that doesn't have a known cause. That was in Santa Clara County in California. The Washington Post reports the second case is a 65-year-old resident who has no known history of travel to countries hit hard by the outbreak. The second case in Santa Clara County is about 90 miles from Sacramento, where the first patient infected with no known cause is hospitalized. That's 9 miles from the Travis Air Force Base in Fairfield, California. That's important because Travis was one of 2 bases in California where infected Americans are under quarantine right now. It's also where a whistleblower says the Department of Health and Human Services sent about 13 workers who had flown with the first Americans evacuated from Wuhan, China, the epicenter of the coronavirus. Now, today, the World Health Organization raised the global risk of the coronavirus to its highest level, warning countries, quote, wake up, get ready. You have a duty to your citizens. You have a duty to the world to be ready. So right now, your health and economic well-being is on the line. And you need a government. We all need a government that we can trust, that will keep you and your family as safe as possible. You need a president who follows the advice of medical experts and science-based facts. But so far, the Trump administration is facing a crisis of confidence and competence in its response to this deadly virus. This week, President Trump repeatedly downplayed the risk. He contradicted his health officials and provided misleading or false statements about this growing health crisis.
We're ordering a lot of different elements of medical.
It's going to disappear. One day it's like a miracle. It will disappear.
No, I don't think it's inevitable. I don't think it's inevitable.
Is this just like flu? Hey, did you get your flu shot?
When it gets a little warmer, it miraculously goes away. I hope that's true.
As the heat comes in, typically that will go away.
And after the man in charge of the coronavirus response, Vice President Mike Pence, argued that the administration will, quote, tune out the politics, this is what the president told his supporters tonight in South Carolina.
The Democrats are politicizing the coronavirus. And this is their new hoax.
This is their new hoax. With all of this information, let's actually get to the truth of what we know right now about coronavirus in the United States. There are now at least 63 cases in the United States. It's possible that there are other cases that have not yet been detected, largely because of this testing issue. NBC News reports, quote, some states received test kits that were inconclusive or only partially accurate. Other states said they were hamstrung by testing criteria that was so narrow it limited who they could screen for the new coronavirus. The CDC says it's making the necessary changes to make test kits more widely available. Meanwhile, NBC is reporting the Trump administration has called off a major summit of Asian leaders next month in Las Vegas because of coronavirus. NBC News' Josh Letterman and Carol Lee report that planning for the special summit of the Association of South Asian Nations, ASEAN, was, quote, abruptly halted on Friday, just as President Donald Trump said he was considering expanding his travel ban to cover countries that had a disproportionately high number of coronavirus cases. All right, joining me now, Ron Klain. This is the man, you've seen him many times on this show, but not for this reason. He was put in charge of the federal government's response to the Ebola virus by President Obama in 2014. Also joining us, someone we're all getting to know fairly well, Lori Garrett, Pulitzer Prize-winning reporter covering global pandemics. Ron, I wish I knew where to start on this thing, but I think the most important thing is that Americans, everybody in the world, really wants their government to give them guidance on this thing, because half of this is science and half of it is psychology and behavior and whether you can trust that your government is in charge of stuff. We got 2 problems on that front. One is we have lots of reasons not to trust Donald Trump. Think Sharpie Gate or the 15 other thousand lies that he's told. And we have real reasons to wonder whether Mike Pence is the guy who should be in charge of this, given that he has spoken and written about needle exchanges not preventing infections and smoking not killing you.
Yeah, I mean, Ali, I wish I could come up with a line better than your point, that it's a crisis of both confidence and competence. On the confidence side, anyone at this point in time who believes what Donald Trump says kind of gets what they deserve at this stage in the game. But the problem is that the administration has silenced the people we can trust. Dr. Tony Fauci, the world's leading infectious disease doctor, who served 7 presidents, Democrat and Republican, has been gagged by this administration. We're used to seeing him out front in this kind of situation. He's been told he can't go on TV unless Mike Pence approves it. Same thing for other leaders at CDC. So we can't trust our president, and the people we can trust aren't being allowed to tell us the truth. And then on competence, you talked about this testing problem. We have had 2 months' notice that we would face this moment. Why didn't the administration accelerate the production of test kits? Why didn't it distribute them more quickly? Why wasn't the president's task force focused on this as task number 1? So I think we have both problems in terms of how we communicate and what's being done.
Lori, let's listen to what Health and Human Services Secretary Azar said a little while ago about these test kits.
Will very soon, through the FDA, be rolling out streamlined guidance that will allow private labs to be able to create their own tests based on essentially the recipe that the CDC has used in their test kit.
Give us some context here. What's he talking about?
Well, the problem is we don't have a standard, and we would like to have everybody getting tested by the exact same standards so that we can compare and we know and we think we have accurate information. At the moment, only about 450 people have been tested nationwide at all. Today, the mayor of New York held a press conference to denounce federal policy, saying we have the competence in the city of New York and in our health department to execute testing ourselves. Why do we have to wait a week to get answers?
Right. The case number 2, I believe, or case number 1 in California, Northern California, that was one of the problems, that they had to get clearance from the CDC to undertake certain testing.
Well, and it's worse than just, you know, do you manage to quickly test the identified suspected case? What we should be doing right now is using the test to do some serious surveillance to figure out, are we really missing a lot of cases? If I were able to wave a magic wand, I would say, let's go into every single pneumonia intensive care unit around the country and test and make sure the cause of their pneumonia is not this coronavirus.
Ron, it's kind of interesting because I work in the news and I work every day, so I don't really know where the politicization of this has come from or where the accusation is coming from of politicization. But Mick Mulvaney, who I'll remind people continues to be the president's acting chief of staff, said this about what the media's role in this is today.
The reason you're saying so much attention to it today is that they think this is going to be what brings down the president. That's what this is all about. I got a note today from a reporter saying, what are you going to do today to calm the markets? And I'm like, really, what I might do today to calm the markets is tell people to turn their televisions off for 24 hours.
What do you think of that, Ron?
Oh, I think it's horrible. Look, one reason why this disease spread so quickly in China was that the truth was suppressed, and there wasn't free flow of information, and there wasn't accurate information. And one of the benefits of the First Amendment and our media in this country is that they're free to tell us what's going on. Now, President Trump's strategy for the past 2 months has been to tweet out happy thoughts about it almost every other day. The virus won't be bad here. It's not really going to come here. I've got the borders sealed, all kinds of other things. And those tweets didn't impress a virus, and they aren't going to save the American people. So what we need is accurate and truthful information through the news media from respected public health officials who communicate with us on a timely basis about what needs to be done, what is being done, what isn't being done, not a bunch of political attacks for people telling the truth.
Lori,